and welcome. My name is Catherine. I'm a block therapy instructor and fascia alignment coach. So I wanted to share with you what block therapy is. So block therapy creates space in the body that's been lost over time. So when we're not aware of our posture, the way that we stand, the way that we sit, the activities that we do, we can start to fall into the body. So we can start to compress. So our shoulders may round forward and we fall into the core. We may look down, looking at screens, tablets, mobile phones. So our neck is forward in, our shoulders may round forward. We may stand with our weight shifted to one side, maybe kick out a leg. We may just stand with our feet pointing inwards or outwards. All these things taking us away from that perfect posture, which nobody does have perfect posture, but all these things that we do creates this tension, this restriction in the body. So throughout the whole of our body we have fascia, and fascia is connective tissue, and its job is to keep us upright. So in the block therapy classes, we will create that space that's been lost due to the fascia that's twisted and turned and locked us out of alignment. So when people say just sit up straight, you may not be able to sit up straight again because that fascia may have locked you in that forward rounded posture, and that's what's causing those restrictions and that pain. We also need to be connecting to the breath. So we need to be breathing diaphragmatically. So lots of us, just due to stress, pain, and over time, we've started to chest breathe. So we need to learn again to breathe from the diaphragm. And each of the positions, I will guide you to start breathing again from the diaphragm. And the more that we do this, the more that habit will kick in, that we'll start to always breathe from the diaphragm. So you want to feel that belly expanding, and that's what I talk about in each of the positions. So we breathe in for a count of 4, we feel the belly expand, and then we breathe out for a count of 6, feeling that belly button going small, imagine it's touching the spine. And that starts to strengthen that diaphragm and starts to get more oxygen flow. When we breathe from the chest, we have 6 times less oxygen in the body. So block therapy's job in the classes that we do is to create that space with the rolled up towel that we'll use, and then there's a block therapy block. So all you'll need for the classes is a medium-sized towel, and you'll just need to roll it up very tightly. So I'll very quickly show you how to roll up the towel. So the towel is just a medium-sized towel, and then you'll just fold it in half. And then you can fold it in half one more time. And then you'll get a cylinder shape and fold it in half again, and then very tightly roll it up. Now you can get an elastic band or a bobble to keep it in place, but you may want to loosen it in certain positions because sometimes the tension might be too much. And the one rule with block therapy is that we always want to be breathing in a relaxed way. So that is your tightly rolled up towel, and then you would just loosen it slightly if it's too intense for you. All the positions that I show you, you can do on the floor, you can do them in a bed, or you can do them in a seat. If you're doing them on a seat, I will show you variations because it's slightly different to what we'll be doing on the floor or on the bed. But you can still do all of these positions in a chair or on the floor. Just let me know, ask any questions in the class, and I'll help guide you. But the one rule is to make sure we're always breathing in a relaxed way. If we breathe in a relaxed way, we help to heal the body. When we hold our breath or we shallow breathe, that's telling the body that we're not safe, that we're not comfortable. So we need to back off. We need to do things in a less intense way, because we need to make sure that we're always keeping the body safe. So breathing and trusting the breath is the one rule in block therapy. When you've been using the rolled up towel, you may then want to go to the block therapy block, which is a wooden block. This just gets in deeper, so does the same thing as the towel. And the reason we use a towel is because of the density is like the wooden block. So we don't want to be using any yoga blocks, any cork blocks, anything else. It is just a rolled up towel or the block therapy wooden block for each of the classes. So these classes are suitable for everybody, whether you've got really intense pain or whether you just don't have any pain, it's just tension, discomfort, or whether you just want to get more flexible. So these can help you whatever stage you're at. Throughout the whole of the body, there is a lot of pain. I found block therapy because I was in pain. My lower back pain was hurting me, and all I was doing was focusing on trying to fix the lower back. But what I've learned through the training I've had in block therapy is that we don't focus on where the pain is. We need to focus on the core site. So when we collapse into the core, there's no space for the organs, and this causes pressure. And so for me, my lower back pain was because of this collapse into the core. I had 2 young children, breastfeeding them, falling in, carrying them, sitting down a lot, and this had caused less space in this area. So I need to create the space again in this area, which then eased the lower back for me. So whatever your issue is, the classes will help you because it's a full body approach. So every class you will feel some benefit. Sometimes, because it's a healing process, you can start to feel a little bit worse. So if you imagine a frozen river, and this frozen river looks beautiful, it's all nice and smooth. This is your body. Your body might be quite dense and quite frozen. So when we start to melt it, and as the river melts, it kind of thaws, and you can see all bits broken up, and it doesn't look as beautiful as it did when it was frozen. And that's what can happen to the body. So lots of healing opportunities can come through. If you have very smooth skin now, cellulite may appear. Cellulite is just the fascia. And as we keep melting, that cellulite will disappear. Just like the river, as it keeps melting, it eventually flows and looks beautiful again. So with block therapy, it is a process. It's something that we consistently need to do. It's not a quick fix, it is a lifestyle change. But once you've experienced block therapy, I know, just like myself, you'll become hooked, because it's something that you can do just so easy with a rolled up towel at home whenever you feel discomfort or pain. So what you can just block or use the towel in the areas that you feel pain, but we do want to take a full body approach. So if you're feeling some tension, for example, in your hip, in your knee, in your foot, you can use the towel or the block just for that area. But in order to get rid of that pain, we need to address the full body. And that's where these classes come in, because they address the full body so that we can find those core sites. So when we're in position, you may feel some discomfort somewhere else in the body, and that's telling you that that's a core site. So if you, for example, you're lying in the fixed hip flexor position and you feel lower back pain or upper back pain, it's telling you that this hip flexor position is a core site to the pain you might be feeling in that back. So I will guide you throughout the classes to help you to feel where the pain is and search for that pain. So we do become pain seekers, and we're searching out the pain to breathe it out of the body, getting rid of all those toxins out of the body. There is a form that when you sign up for a class that you will need to read, and you just need to let me know that if you are pregnant, because the stomach position we can't be doing, if you've got any medical conditions that I need to be aware of, and if you have any implants, because we can't be blocking on the implants as well. So in that form, I just need you to read it and reply back to me to confirm that you've read it, and let me know of anything so I can adjust the class for you. So thank you so much for listening, and I look forward to seeing you in class. And if you've got any questions, please reach out to me. Thank you.